Hi guys, Brad Thornton here and welcome to Ivory Dental Practice. So at the moment, as I've explained before, we are not allowed to see patients face to face due to the sort of legislative and guidance that we've been given by our regulatory bodies. So during the coronavirus sort of period that we're in at the moment, we're avoiding all face-to-face contact as a way to try and, prevent the transmission of the virus. As everybody is, we're in lockdown at the moment. So we've been giving phone advice, we've been discussing things with patients over the phone, on social media, via WhatsApp, things like that. And there are always a few questions that tend to crop up when you're having these conversations, especially if you have toothache. So I thought I'd answer a couple of those, or the main one today, but other ones in subsequent videos. Things that crop up regularly, common themes, just as a way to hopefully try and educate, provide a little bit of value, and maybe answer a couple of questions that you might have, especially if you're going through a little bit of toothache at the moment and you kind of wondering what to do. What I'll do is I'll discuss a few different sort of stages of toothache, but a really important one is actually the point at which we know you've got an infection or an abscess, because that's the point where antibiotics become helpful and become useful. Up until that point, no matter how bad the toothache is, if there isn't an infection there, antibiotics just will not be beneficial at all. They won't help. So it's important because to know that, because we tend to ask questions to try and figure out at what stage the tooth is at, because dependent on the stage will depend on what type of remedy or what type of treatment would be beneficial. Now, under normal circumstances, at a practice we have a huge number of different techniques, diagnostic and ways that we can figure out where a tooth is on this timeline, and then have a number of different treatments that we can do to deal with whatever it is that's causing that toothache. But because of where we're at, for the sake of the fact that we are in a lockdown situation, I'll try and make this more relevant to the circumstances that we're in. I'm going to use my little teeny tiny tooth model. Just a bit of a quick description. Let's ignore some of these at the top end of it, but the red bit in the middle, that's where the nerve lives. The reason it's red is because as well as the nerve being inside the tooth, you've also got blood vessels that flow through the tooth to provide blood supply and also nerve innervation, basically so you can feel the tooth and to make sure that your tooth is alive. That's where everything lives. This yellow area is kind of like the hard part of the tooth that encases the nerve chamber, and the white bit on the outside is the enamel, the really hard chewing part of the tooth. So whenever you've got a healthy tooth, that was this one, everything's intact, there's no crack, there's no tooth decay, there's no exposed areas. Now when you tend to get sensitivity, there's a number of reasons that can happen. And the first type of sensitivity that people get tends to be quite low grade, tends to be in response to something. So it might be a cold drink, it might be ice cream, it might be a warm drink. There are a few different things that can cause somebody to have kind of like a minor sensitivity. At that stage, if it is in response to stimulus, so something happens, your tooth becomes sensitive, as soon as the thing stops, the sensitivity disappears. It's usually very quick, short, sharp sensitivity, and then relaxes, and then everything's normal again. That kind of sensitivity, the best way to manage that is using things like topical fluoride toothpaste, maybe a desensitizing toothpaste, as well as using it to brush your teeth with, remembering that you don't rinse after you brush your teeth, you just spit the toothpaste out. It can often be quite helpful if the sensitivity is particularly annoying or maybe getting a bit more frequent, a little bit more uncomfortable. You can actually get it on your finger and rub it around the affected area, and that can actually have a desensitizing effect and kind of keep things a little bit more managed, a little bit less discomfort, until we get to a point where a dentist can have a look at it, use something that's a little bit stronger, maybe seal any exposed areas up. Sometimes you might have a little bit of tooth decay which will then need repairing. On that, if the sensitivity is getting worse and you do actually become aware of a hole or a cavity or a lost filling, you can get temporary filling kits. I do believe there are availability there, although it is dwindling a little bit because of the circumstances, but you can find them in supermarkets, online or Amazon, something like that. And if you are aware of a cavity or a lost filling that is causing a tooth to feel sharp or sensitive, then you can use the temporary filling material kind of to pack the area for the time being, and they are reasonably effective. They're not perfect, they're not amazing, but for the time being, something like that might be quite helpful. So in these early stages, the sensitivity tends not to be too bad in response to stimulus. Maybe there's a bit of a cavity there or a bit of a lost filling that you can use a temporary filling material for. Topical toothpaste, using a desensitizing toothpaste, is quite helpful. Now, if that sensitivity starts to get worse, what that might mean is the nerve inside the tooth, for whatever reason, is starting to get more and more irritated by the cause of that sensitivity. So maybe you've got a larger area of an exposed area. Maybe if there's tooth decay, the tooth decay is getting a little bit closer, like this one. That black bit is getting a little bit closer to the nerve. Maybe there's a crack in the tooth, maybe the bit of filling that's been lost is a little bit larger. But for whatever reason, the nerve starts to get a little bit more irritated and agitated by whatever is causing that sensitivity. Now, what then starts to happen, similar to if you stubbed a toe or twisted an ankle, your body creates a little bit of inflammation. So you get swelling of this nerve chamber, the nerve area within the tooth starts to swell a little bit. And that's when your pain can start to go from being a little bit lower level, only in response to stimulus. It can start to change to be something that's more random, that's more long lasting, that's more of an ache than a short, sharp pain, can start to become a little bit less bearable. Because it's in response to inflammation, you tend to find, in the current circumstances, the best thing to do is to look at the analgesics, the over-the-counter pain relief. Now, there is some evidence that anti-inflammatories like ibuprofen can affect the symptoms of the coronavirus. So what we tend to say is try and use paracetamol as best as you can at the moment. Try and sort of reduce any pain that you've got for the time being using over-the-counter analgesics. That'll hopefully have an impact on this nerve discomfort that you're getting from inside the tooth. At this stage, if the nerve is getting very agitated and is getting quite inflamed and the symptoms are getting a lot worse, that can be a sign that the nerve actually just isn't healthy anymore. And if it was normal working practice, this would be the point at which we would be advising you to have a root canal or for you to have an extraction. Because that's not possible at the moment, you'll have to still use the topical desensitizers, still use temporary filler material if you need to, or if there's a cavity or something's broken, but be using analgesics to try and reduce any discomfort that you've got at the moment. At this stage, antibiotics still aren't effective, unfortunately. Now, what happens with this inflammation is that the pressure inside that encased nerve chamber goes up to the point where the blood supply to the nerve gets cut off. So after a little while of quite bad discomfort, unfortunately, the nerve will die. At that stage, you tend to find that actually the discomfort just disappears, and your pain will go. So things will improve in your eyes, the symptoms will settle, and things may feel a lot better for the time being. Now, at that stage, what we are waiting for, if no treatment is carried out, is for the infection to begin, because that is the next stage. At the stage where the nerve is dying, the brain cannot locate easily where that discomfort is coming from. That's why sometimes if someone's got toothache, you're wondering where it's coming from. Is it the back tooth? Is it the tooth in front? Sometimes it radiates and spreads to the top teeth when it's the bottom tooth, and it can just feel like it's coming from a number of teeth and you can't quite pinpoint it. The reason for that is the brain's GPS inside here doesn't work. So if you've got a nerve pain from within a tooth, your brain very often can't figure out where it's coming from. So once that has gone through the process of inflammation, quite bad discomfort, the analgesics hopefully will be helping a little bit but might not be helping a huge amount. You get to a point where the nerve will die because the pressure causes the blood supply to disappear and gets cut off, so the nerve dies. So the pain will disappear, you'll find that the symptoms will ease up. What then starts to happen, ignore the fact that this tooth is broken. This little area at the bottom, once the nerve has died, that's because bacteria tend to build up within the nerve chamber because the nerve is dead. And once they start to sort of expand further, your body starts to react to that, and you start to get an abscess, you start to get an infection. At that point, you will start to get the symptoms back again. Because it's happening at the base of the tooth, you tend to find that pressure becomes quite painful. You may get swelling around the jawline, around the tooth. The brain's GPS kicks in, and you can point straight to where that pain's coming from. It's at that stage where we would normally be saying, antibiotics are going to start to ease the pressure and ease the discomfort and ease the infection. Because we're in the sort of coronavirus phase, you'll have to be speaking to the dentist to decide whether or not at this point you get prescribed some antibiotics to ease things up. Because if this gets left unchecked, the risk is that these swellings can get worse. They can start to affect things generally, your general systemic health or overall health. And if you have a swell, it's really important that we don't allow swellings to expand, because especially around the dental area, you're not far from swallowing, not far from breathing, you're not far from eye, things like that. So it's important that once we know there's an infection starting, at that stage, the antibiotics become helpful. They will not only reduce the infection, but they will actually reduce the pain as well. They aren't going to get rid of the cause of the infection, which is the tooth. The tooth still needs treatment, but for the time being, whilst we're in lockdown phase, until we can get local dental centres set up to allow treatment, or we can get dental practices back up and running at some point, the antibiotics is the best thing to do if we know you have an infection. So if you're at home and you've got a toothache, if it's a low-grade toothache that is only with sensitivity with, let's say, something cold, and it's maybe a bit worse than you're used to having it, or maybe you've got a little cavity in a tooth that's causing a little bit of sensitivity periodically when you have something to eat, you can use temporary filler material, some topical toothpaste that might help to desensitize things, and just manage it from home. You don't really need to have anything else at the moment. If the pain is getting a little bit more unbearable, it's happening randomly, not because of anything particular. It can be day, night, it's keeping you up at night. That's when we start to need analgesics, pain relief, things that you can buy over the counter, and hopefully riding that out until a point where we get a sort of resolution of symptoms. But at that stage, we're waiting for the next phase. So if you're in a situation where you feel that you've got a bit of swelling, that you've got discomfort on pressure, it's important at that stage to start looking at trying to get some antibiotics. So make sure that you're either speaking to your dentist if possible, ringing 111, because what we don't want is the dental infection to spread and to affect anything to do with the throat and the airway, or anything to go higher up and affect the eye and things like that. So if you've got pressure, pain, swelling, then make sure you're getting some antibiotics if you can. I hope that's been helpful. I'm noticing that we're on 30 minutes of dental chat. I don't know how useful this was, but hopefully explain things a little bit easier. If more questions crop up, I'll do another video. I'll try and keep them a little bit shorter. I think because this affects quite a lot of people, and people can be in various different stages of toothache, it's important to go through all of them, just so you can try and have an idea of where you might be. The further topics that I'll go through probably won't be as long as this one. But if you've got any questions, like I said, you can fire them over social media, and we'll try and answer as best as we can. If you're a patient, ring the practice. You will be diverted to a voicemail that I'll pick up, and I'll give you a call back if you've got any issues that we need to discuss. Try and get things back to normal as quickly as we can. I am there for you. We are here to support you, so make sure that you don't sit on something that you feel you'd want to talk to a dentist about. Give us a call, send us a message, and I'll get back to you as soon as I can. Stay safe, we'll get through this together. It won't take that long, we'll be back to normal as soon as we can. So yeah, stay safe everybody, and hope to see you all soon.